Hi there, folks. It's Gavin from Gavin Physiotherapy. Good to see you all there. You are watching the 10x Physio channel. Wonderful to see you all today. And today I would like to introduce you to Mr. Ed Thompson from Ed Thompson Physio. He's a well-renowned physiotherapist working in London at Instant Physio. So go check him out if you are in London and need any aches and pains sorted out. So today we really wanted to talk about ski season, because ski season is coming soon. So I would like to say that at both our clinics we do see quite a lot of skiers who've picked up little bits of piece of pain, a few niggles, both before they go skiing but also whilst they've been skiing. So I'm going to just ask Ed a few questions. Ed's probably going to ask me a few things and we'll just sort of take things from there. So Ed, what would you say is one of the most common injuries that you see coming through your clinic for the ski season?
It's a good question. Yeah, thanks for the introduction. It's kind of ironic we're talking about ski injuries because we're in sunny Florida right now, so it's quite a different climate. I think Gav might have got a little bit of sunburn earlier, so but I guess you can get sunburn whilst you're skiing as well. But yeah, I'd say that the number one injury that we see is an ACL tear, so or some sort of ligament tear of the knee, basically, and that's going to be something that is normally a traumatic injury that would happen on the slopes and would normally be an injury that would stop someone's holiday and make it so they can't really continue, and sometimes in lots of cases they might need surgery to treat the injury and repair the ligament so that the stability comes back in the knee, and again that's really common. Another one would be hand injuries, thumb injuries, so they're really common where you're going for a fall, you fall onto your hands and your thumb or your finger gets caught, and it's really common to tear some of the ligaments in your thumb, and that's another nasty one as well.
Yeah, very nasty. I actually want to come back to your knee injuries. I know you say you see lots of ACL injuries from skiing. So, because we see this as well, and I'm hoping that your advice probably won't differ too much from ours either with that, but if you have somebody coming to you who's got a little niggle or somebody who wants to prepare for the ski season, what kind of things are you going to get that person to actually do to say prepare their knees for the ski season?
The biggest thing that we're going to get them to do is strength and conditioning. So we're going to use isometrics often to prepare the knee for what it's going to need to do, which is work in an isometric way. So it's things like your quadriceps, your hip muscles, your hamstrings, and the different planes of movement that someone's going to have to do. So your frontal plane, which is kind of lateral side to side motion, and your transverse plane, which is the twisting kind of plane of motion. So we need to prepare the body to get used to those types of movements, because in day-to-day life, less depending on what sport you play regularly, things like twisting movements aren't a common thing that your knee is going to be used to. So that's something we would definitely want to train them to be good at, to help prepare them for skiing so that they protect their knees. And then similarly in the sagittal plane as well, so where it's that kind of forward and back motion that so really preparing the knee in all the different planes of movement, and using strength and conditioning and agility training to prepare the knee for all the stuff that goes on it.
I would say I'm very much with you there. I'm very much encourage people to go to the gym to work on that strength and conditioning for their skiing holidays, because for anybody who's been skiing or for people who are preparing to go skiing, you'll tend to find technique is everything, and when your technique's just not quite up to par, or you're new to skiing, you'll tend to find that your quads work quite a lot. So skiing's definitely much easier when you don't have to use your quads a lot, and you get the rest of your body strengthened up in and around the hips.
Yeah, and those accidents tend to happen towards the end of the day, when the legs are tired. So
slopes tend to be a bit icier as well, so you've got to really be on the ball too.
Yeah, and there's probably a few more beers that have been consumed by the end of the day as well. So
maybe a few glue vines at lunch.
So you got to watch out for the drunk drivers.
So stick to the hot chocolates, folks.
That should be the number one step. And I think it's a huge factor, definitely. I know that we treated someone last year, and she was a lady in her 50s, and she wasn't doing anything kind of advanced or going down any black runs, but it was right at the end of the day, and it was the last run of the day, and she kind of felt like, I really can't, I don't have the legs for this, but I'll just do it because everyone else is doing it. And then I think she got her skis kind of crossed over, and then someone kind of barged into her, and then before she knew it, she'd torn her ACL basically. And that's where it's the question of, is it preventable? And
sometimes I think it's very much listen to what your body's telling you through the day. If you are starting to feel tired, then your body's feeling tired, and you're not necessarily going to be firing on your full cylinders. Your body will be fatigued, so you're leaving yourself open to that increased risk of injury. So you've got to be really more aware of that.
Have you had any injuries on the slopes?
I will have to say that I have never been injured whilst I've been skiing. I don't think I'm a good enough skier to get injured. No, I'm only joking, but it's one of the things I do really think about is I'm wary of feeling fatigued. And I don't ski fast anyway. Because I'm a bit more wary that I actually like my ligaments to work, and I like the legs to be strong. I don't want to be injured and out of action, so I'll tend to, when I feel I'm starting to feel tired, I'll tend to head home. And
I think I came across a study which found a correlation between something like men under 30 at 12 weeks of experience in skiing was like the perfect time for them to tear their ACL, because their confidence is higher than their ability. So they think, I've been skiing after 12 weeks, and I'm actually quite good now. The classic kind of male ego kicking in, and that's when they'll do something way harder than they could do, like going off a jump or doing like a black run or something like that.
But you've also don't forget, you've also got those accidents where other skiers are not in full control, and you have no control over them. Sometimes they have no control of themselves. Accidents do happen, and they can crash into you and cause you serious injury. So that's just one of those unfortunate things.
But I guess again, sometimes when you're looking at it through a physio lens, which Gav's been a physio for
too many years.
And we've both seen so many people coming in with ACL injuries after a skiing holiday, and we probably get that slightly blinkered view of we don't want to kind of scare people from not going skiing, and it doesn't mean that the risk is so high that we need to be really frantically kind of concerned about these kind of things. But there's definitely really big steps that you can take.
Lots of preparation work. Again, with that strength and conditioning, and working on your balance as well. They all have great benefits for you before you go skiing. So do definitely do that.
What would you say? I mean, do you ever see people who have had an ACL injury and they're going back to skiing, and they're just wanting to kind of be confident on the slopes? Would you use the same type of tools to help prepare them?
Again, I'm going to say, I actually treated a lady one time who very unfortunately ruptured both ACLs, so both knees at the same time.
Wow.
Now she was a racer, so she was a downhill racer, and had just caught one of the flags,
Right.
which sent her at a high speed spin tumble. So so very much it's the same tools that you want to use for those people. It's strength, conditioning, and I suppose help giving them the confidence
Definitely, yeah, that's a big
to get back. So you have to really get them used to a little bit of plyometric work.
Yeah.
So jumping, hopping,
Yeah.
side to side, forward, back,
Yeah.
from heights.
Yeah. It's true, yeah, because mindset-wise, if someone's really, really lacking confidence,
Yeah.
it could really massively change how they move. And I wouldn't be able to say that it's going to increase your risk of injury, but it's going to make you move differently. And
I know skiers who have injured themselves on the slopes, who just haven't got back to it because they've lost that confidence to get back out there.
Yeah.
So I suppose it's one of those things that, it's easy to say it. I would say, get back on the slopes sooner rather than later after you've injured yourself. It's all very dependent on when, on whenever you can go and do that. But the longer you leave it, the more that confidence definitely lacks. I suppose you could say it about any kind of sport or anything, but you just gotta get out there and get back as quickly as you can. But again, if you've injured, it's all about going through that whole rehab process and preparing your body for what you're going to be asking it to do. So you've got your cardiovascular fitness as well. Anybody that's been skiing knows that it can be a long, hard slog if you're on the slopes and up and down the mountains all day. So cardiovascular fitness, very important, as well as having that strength to do everything too.
And I think the confidence comes back, with those baby steps and just with just going through the motions as well. Because what definitely wouldn't be a good idea is just not doing any prep and then saying, right, I'm going to go back out on the slopes, and you kind of, that's why again, good physio, good good work with a therapist just does that and helps kind of build that confidence slowly as well.
And I think when you go with an experienced therapist, a physiotherapist, sports therapist, whoever you see, somebody who's had that experience from skiing, who's got that experience from a strength and conditioning perspective, when you're able to see one of those specialist therapists, really draw from their experience and their advice, because they've been there and done it. They've maybe been skiing, but they've also treated lots of those patients as well, and got them back to skiing. So very important that you do that.
I mean, they are definitely the most common injuries that we see. In terms of other injuries that we see, do you see many hip problems from skiing?
I'll be honest with you, I haven't actually seen too many hip injuries. It's not to say they don't happen. I've seen a couple of fractured collarbones from falls, which again, also that's I did have a friend once who, day one of the holiday, fell, and he actually fell on quite an easy run and fractured collarbone, so he was flown home.
Seriously? Day
2.
Game over, And like rib fractures as well, just from falling. And
just falls.
It's but they're the kind of injuries that do just put a stop to your whole trip. I mean, I've been on holidays with people who've almost had like tendonitis in their knee, where towards the end of the trip, the front of the knee is just starting to get more and more painful because of an old injury perhaps, or they just don't do any strength and conditioning ever, and the amount of stress they're putting through the knee has got to a point where it's causing a bit of a reaction in the knee. So it's not like a trauma, it's just a build-up of overload and stress that the knee can't tolerate. And someone with this guy in particular, is a friend of mine, taping can help quite a lot. Massage can help just to work on trying to get out some of the tension in your quadriceps and just
by the way, you can check out my YouTube video on massage benefits, so look that up. I'll maybe try and pop a link in with this video. It's a total plug, by the way, sorry. But yeah, massage does definitely help with recovery.
Ice as well, yeah, that's just going to help, mostly for pain relief. But it's quite common to get those kind of injuries because let's say you are going out in the evening and having a good time and not sleeping the best. That can be a recipe for these types of injuries.
More fatigue sets in. Which we don't want.
You get that REM sleep, and because you're kind of enjoying the après ski, which does happen a lot on the slopes. And sometimes having those tools can be quite useful because it's annoying to have to stop skiing altogether.
Oh,
when you're on a holiday you paid a lot of money for.
Definitely.
But obviously that's treating the symptom, but what we talked about earlier in the video is trying to treat the cause and do the work before to prevent this kind of thing from happening, because the same kind of things will help prevent that. So S&C, strength and conditioning, and spending a good 3 months before the trip if you can, working on getting your strength up.
So and like my definitely one of my bits of advice. We've got very noisy car drivers out here. Apologies about that. So one of the things that I would definitely say for somebody to do before they go skiing is go and see a physiotherapist or your sports therapist who can help you look at what your body's doing to find out how well your body is prepared for going on a skiing holiday, and they can definitely be able to assess your strength, your joint stability.
Do you call it ski hab?
Ski hab's actually quite a good. I like that. Ski hab, it's your sort of prehab for ski hab. We just coined that phrase, by the way. It's
a massive thing. I think the mistake to make with that would be to go the week before you go skiing, because the impact you could have in that week between the
you're not going to get, your body's not going to be necessarily very well prepared.
Whereas 6 weeks, 12 weeks before,
perfect. Really good time. It's enough time for your body to adapt to increased physical activity. If you are working on your strength and your cardiovascular fitness.
I would also say if you've had an injury going into that skiing trip, I'd say that's even more important, because you sprain your ankle and the pain stops and you're able to go back to your normal activity. If you haven't done any rehabilitation for that ankle injury, there's going to be the legacy of that ankle injury that will mean you might be weaker on that side, the balance might not be as good, and when you're in the slopes, that's going to be when you notice it. So if you have had an injury like a lower limb injury, so a leg injury, then I would say that ski hab or the kind of ski assessment would be even more important, because it's actually going to have a really, really good impact. Sounds like we're on a racetrack.
It's definitely not. So ski hab, prehab is one of those things to definitely take note of and to do. Let's see. Actually, one of the other things I think is very important, which people maybe don't necessarily think an awful lot about, is that when you're actually getting measured up for your skis, that your boots do fit into the clips of the skis, and they have to be really calibrated correctly for you. So most ski resorts will have somebody who does that. When you go to get your ski boots and your skis from the hire shop, all I'm going to say is please give them your correct weight and your correct height. If you try to lie about that, apologies folks, the amount of tension that they put through those clips could actually not work in your favor. So remember those clips are supposed to give and your boot's supposed to come out. if you do fall, that's meant to happen. If you give the people an incorrect weight, then your boot could stay stuck in the ski, which will also then mean you are increasing your risk of doing some serious damage to your knee. So
yeah, that's a really good one. Yeah,
I've seen it happen.
Yeah, again, it's a very controllable thing that you could very easily
just mitigate those those risks, I suppose, is what we're trying to say with everything, and get yourself to being the fittest and strongest that you can possibly be for when you go skiing.
No, it's I mean, your environment, your biomechanics, and your kit is some of the real big factors that you can really influence to stop a nasty injury happening. Definitely.
So there we go, folks. I think that's probably about us with everything. With skiing injuries and prehab, skihab. So again, make sure you are going to go and see a physio, sports therapist if you're going skiing, and get yourself sorted for the ski season. I'd like to really take this opportunity to thank Ed from Instant Physio. Go and check him out on YouTube, or if you're traveling in London and pick up any little niggles or anything, go and see Ed. He's in Tooting in London. And with that, I'm Gavin from Gavin Noble Physiotherapy. You've been watching the 10X Physio channel, and thank you very much.
Thanks,
Please
Gav.
subscribe to the channel.